Okay, friends. Hey, here we are. I was on the wrong page. Forgive me for joining you a few minutes late here. This is Foster Talk with Dr. John. I'm your host, Dr. John DeGarmo, founder and director of the Foster Care Institute, foster parent to 60 plus kids, author of many of the foster care books that are probably in your bookshelf, but I that you're spending some time with us tonight. We do it every Tuesday nights right here, 7 to 7. I'm sorry, that's right. That's wrong. 8 to 8:30 p.m. That's right. We changed the time. 30 p.m. Eastern Time right here live. And I'm so glad that you are here with us tonight. Thank you for spending some of your Tuesday night with us. If you're, for goodness gracious, why is that on that page there? I want to be on the different page. Um, yeah, okay. So if you are here with us for the very first time, I want to say welcome. So glad you're here with us tonight. Three rules. Three rules. Rule number one is this. No one understands a foster parent. No one understands the lifestyle of a foster parent unless as another foster parent. It's a very unique lifestyle that your friends, your family members, those closest to you are never really going to truly understand or appreciate. That's why what we do here is so important. So I want you to go ahead and tag one of your friends that's a foster parent, invite them to join us tonight so we can learn from them. Rule number two is this. I want you to ask anything you want. Doesn't matter what the question is. We're here to answer all your questions here live, whether it's foster care, adoption, kinship, parenting in general. Doesn't matter what it is. Go ahead and make sure that you ask anything you want. You want to ask questions about me as a foster parent to 60 plus kids. You want to ask some of the times I felt like quitting. You want to ask a personal question about me. Doesn't matter what it is. We're here to answer your questions live, right? And hey, Elena, glad you're here this tonight. And third, Elena, I sent you a book in the mail today. Hope you get it soon. And third rule, my favorite rule, I know a lot of you love this rule too. If someone asks a question tonight, if someone makes a statement tonight, you think, Dr. John, wait, hey, Leslie, so glad you're here this tonight, Leslie. If someone asks a question or makes a statement, you think, Dr. John, wait a minute, Dr. John, wait a minute, Dr. John, I've been there, I've done that, I can answer. We want to hear from you. I want to hear from you. I was just in Texas. I've been in Alabama, going to Pennsylvania this week, but to do a lot of training for other foster parents. I love to meet other foster parents like you. I love to get to listen to your stories. When you come up to me after the speaking events, I love when you share part of your stories because I'm learning from you. So that's what we want. We want to learn from each other tonight, okay? So again, next 30 minutes, we're answering your questions, whatever you need help with, whatever you're struggling with right now. If you feel like quitting, I've been there. If you've questioned the system, guess what? I've been there. If you're frustrated with how the foster care system works in general, I've been there. I've walked in your shoes. So let's learn together tonight. All right, let's dive into our questions. Let's go to Taylor. Taylor asks us, how does the adoption home study and process differ from the initial licensing? We have a newborn placement that they have already made clear is likely going to adoption, and I'm wondering what to expect when the time comes. Do they dig even deeper into backgrounds, financials, etc., or is it a similar process? Taylor, I'm so glad you asked. Thank you for asking. About 120,000 children each year in the foster care system are up for adoption. And if you've read any of my books, you've seen my TED Talk, you've seen me speak in person, then you know I've had 3 adoptions and I've had 4 failed adoptions. So I've experienced both. Taylor, it is a similar process. They do dig a little bit deeper, but I want you to know this. So before the child is initially up for adoption, they're going to do a background search for other family members, other biological family members. It might be a grandparent, an aunt, an uncle, a cousin, maybe an older sibling. And when they don't find anybody that wishes to adopt a child, then most likely you will have the first rights for adoption. What I want you to recognize is this, so Taylor, most importantly, I think, is this. Post-adoption depression syndrome. Post-adoption depression syndrome, PADS, does not happen necessarily just for the child is adopted. We need to remember that adoption is a loss for the child. However wonderful and beautiful and glorious and loving the adoption can be, it's still a time of loss. But remember this, keep this in mind. 65% of adoptive parents, that's right, 65% of adoptive parents experience post-adoption depression syndrome. So I want you to be prepared for that, Taylor, okay? Recognize that. So I want you to check out the video, the training webinar here. We have it here at the Foster Care Institute. Hopefully, Taylor, you're already a member. Post-adoption depression syndrome, because I want you to be prepared for the very good likelihood that both you and the child are going to suffer from post-adoption depression syndrome, okay? Hey, Taylor, thank you so much for asking. Glad you're here with us tonight. Okay, let's dig into our next question. Leslie, glad you're here with us tonight. Leslie asks this. Let me pull Leslie's question up here. Leslie says, I have had 12 kids in the 4 years of fostering, but my current placement and I are really struggling with. The therapist says she has too many behaviors and can't help us. Well, Leslie, I'd love to hear a little bit more about what you're struggling with. You say you're struggling with the current placement. What is that struggling with? Does the child have anger management issues? Is there eating disorders? Or is there lack of trust or attachment? Is there reactive attachment disorder? What might that look like? Leslie, we have many, many webinars here at the Foster Care Institute that can help you. Leslie, I'm hoping that you're already a member. You're already a member, special member, and have access to all of our training webinars. But go into detail. Give me a little bit more explanation, Leslie, about maybe what you're struggling with. So a little bit more insight so I can go into that, okay? Again, Leslie, thank you so much for being here, and I look forward to learning a little bit more about what you're struggling with. Elena reminds us the 3 important words about foster parenting: documentation, documentation, documentation. At the Foster Care Institute, we have a documentation book that you can download. Has all the documentation forms, files, ledgers, information that you need to properly document. Okay, Leslie says sexual behaviors. Well, Leslie, my next question for you is, how old is a child? I'd have to have a little bit of background, Leslie. Leslie, I don't know if you know this or not, but I am a personal counselor. I counsel foster parents online through video Skype. Through video, I offer counseling sessions. So Leslie, if you want to have a personal counseling session with me, I'd be happy to have that with you. But I don't want to have, I'd have questions like this. How old is hey, Kathy, glad you're here this tonight. Sonia, so glad you're here this tonight. Dr. James, glad you're here this tonight. I'd want to know how old the child is, what the child's history is. Lies, steals, not appropriate with adult. Well, many times, Leslie, children in foster care do lie because they're trying to A, protect themselves, but also B, they want to have this, they have this image in their mind of a perfect family, and maybe they're trying to impress you. Child is 13 years of age but delayed. Well, if a child is sexually active, you do need therapy to be sure. This is not something that you can correct on your own. I would encourage you to check out a couple of webinars we have. Positive Parenting Solutions. I would ask you to look at that. Trauma-Informed Parenting Part 1, Trauma-Informed Parenting Part 2. I believe we may have one on sexual behavior as well. Those are some great webinars I think you're probably going to want to look at, okay? All right. Hey, this is Foster Talk with Dr. John. Hey, Sonia. Friends, welcome to Foster. Right there. Hey, Sonia, so glad you're here for that. Thank you for those very kind comments there. All right, we want to answer your questions here. Again, no questions off limits. This is Dr. John, Foster Talk with Dr. John. We're answering your questions for the next 20 minutes or so, and we want to make sure that we get your questions answered there. Leslie says, I don't have much information on her and not met the social worker yet. Well, Leslie, when you do meet with a social worker, make sure you get as much information as you possibly can, because you want, the more information you have, the more empowered you are to give the child the support services the child truly needs. If you have the book, The Foster Parenting Manual, and I got a couple copies down there I can send you. They have a whole list of questions that I ask every time a child's placed in my home. I need to know that information. I would want to know about the information about the child's sexual behavior before being placed in my home, so I can make sure that I have the right support services, the right resources that the child does need. Okay, so yeah, appreciate you being here. Hey, Foster Talk with Dr. John. We're answering your questions tonight. Nicole says this: at what point does helping become enabling? Last week we did agree to take the little ones when BioMom reached out. We've had them 4 to 7 days, and she's already asked for us to take them the entire next week. When updated, the caseworker, let's see, how do I know if what we're doing is right or wrong? I feel for these babies each time I drop them off. The 2-year-old melts down. I bring them back to BioMom, clings to me. Well, Nicole, I appreciate you asking. If it's in regards to visitation, remember, visitations are court-ordered thing. All right, you've got to do them, but you need to make sure you're properly documenting all that's going on in the visitation, right, Nicole? Because you need to document what's happening, what you're seeing. If you think the child's having this meltdown when the child jumps off, and when you bring them back and the child's clinging to you, the caseworker needs to know all of that. And there's a proper way to document, and there's a wrong way to document. Nicole, hopefully you're going to do it the right way. Again, download the foster parent documentation book here at the Foster Care Institute. It's going to give you all the information that you need. Don't worry about enabling the birth parents. What I want you to do is make sure you're protecting the child and protecting yourself. You're protecting yourself from any false accusations or allegations that might come your way from the birth parents, okay? So that's why you properly document, okay? I want to say hello to Michael. See that Michael's here with us tonight. Bray, glad you're here with us tonight, Bray. Elise, so glad you're here with us tonight. I see that Kathy is, and Michelle's here tonight too. Welcome to Foster Talk with Dr. John. So glad you're here with us tonight. We're answering your questions right here live, 8 to 8:30 p.m. Remember, no questions off limits. Let me do a little bit of plug here. Let me do a quick little plug. Earlier today, our newsletter from the Foster Care Institute went out to over 12,000 people. I hope you got it. Had the foster care news of the week, the foster care video of the week, the foster care webinar of the week, the motivational moment, and a whole lot more. Foster care tip of the week, whole lot more. If you didn't get it, type in I want newsletter, put your email address. I want newsletter, put your email address. We'll make sure you get that newsletter first thing tomorrow morning. Okay. Delaney, welcome, Delaney, to Foster Talk with Dr. John. Delaney says, why do some parents have criminal charges for neglect and abuse, but others don't? Well, Delaney, quite simply, some parents may have neglected a child. Some parents may not have. Children come into foster care for a number of reasons. And neglect is one of those reasons. Abuse is one of those reasons. There may be abandonment, death of a family member, incarceration, drug use. There's a number of reasons why children come into foster care, and neglect and abuse are just a couple of them. Now, to be sure, Delaney, the majority of children placed in foster care today across the nation are coming in due to neglect. The majority that's come to my home have come in from drug use. All right. Really appreciate you asking there. This is in regards to the situation I brought last week. Reunification happened, but mom is struggling and reaching out to us. You know, Nicole, you'd have to give me more information on what you said last week. You know, I have so many questions each and every single week. I'm afraid, Nicole, my brain is not so big that I can remember the questions. I've had so many conferences today with foster parents doing a lot of consulting and counseling sessions with them and with agencies as well. So I'm afraid you might have to give me a little bit more information about that. Hey, Brenda, we'll get that newsletter to you tomorrow morning. If not tonight, tomorrow morning. Please make sure you look out for it, okay? Okay. All right. Let us go on here. Why are some of the standards for the same for DCF for foster adoptive homes the same for reunification? For example, bio parents have a pool but no safety features, but foster parents have to jump through hoops to have a body of water bigger than 2 feet. State of Kansas. Yes, Delaney, I understand. It's just how the system works, all right? Why aren't the standards the same for adoptive parents? Reunification. Delaney, I get it. It's one of those frustrating things to be sure. I completely understand what you're asking there. It's just how the system works. Remember, when a child is placed into our home, they're placed into our home. We are providing a service to them. So the agencies have to ensure that the child is placed into a home that is completely safe, that has stability, structure, consistency. Most of all, the child is safe. So there are going to be a number of hoops, as you mentioned, that we as foster parents have to jump through. And it might seem that sometimes those birth parents don't have to go through the same hoops. Well, sometimes that is the case. All right, appreciate you asking. Thank you so much for being here. Hey, this is Foster Talk with Dr. John. We've got another 15 more minutes answering your questions here live right here. Again, think of it as your foster parent support group. And if someone asks a question and you think you can answer it, we want to hear how you did it. Taylor asked, Nicole asked a question about enabling the bio parents by continuing to watch the kids after reunification. Nicole asked a question about enabling the bio parents by continuing to watch the kids after. Oh, that's right, Taylor. Thank you so much for that reminder. Yes. No, you know what? I think that my personal experience here and working with foster parents across the country, if you have the opportunity to help out the child after the child's gone back home for reunification, by all means, you need to do that. Now, keep this in mind, Nicole and Taylor. So, the child goes back home to the birth parents, and the birth parents ask you to continue to watch the child. Well, there's a good chance that birth parent still is not prepared, still is not ready, still does not have the support services that they need to care for the child. You're not really enabling the parent because if the parent was truly healed from their trauma and their anxiety and they've got the true support services and the help they need, then they will not need you to care for the child. But the reason they're asking you to care for the child is because they need help. They need help. And more importantly, the child needs you. Are you enabling the birth parent? Perhaps, but more importantly, you're keeping that child safe. And if this birth parent continues to ask you for help, there is that chance, Nicole. There is a chance the child could come back into foster care again because the birth parent may have slipped backwards, right? So if you built this relationship with the birth parent by caring for this child, and the child is placed back into care, there's a good chance, Nicole, that birth parent may request you to care for their child when the child's placed back into foster care. Or the agency might say, you know what, these foster parents have been doing so much to care for this child, they're going to place the child back with you. All right. So again, don't think about enabling the parents. What you're really doing is ensuring the child is kept safe. Hey, I'm so glad you asked. Thank you for being here. Taylor, thank you for that gentle reminder there. Sometimes I seem to forget. Yeah. Hey, this is Foster Talk with Dr. John. I'm your host, Dr. John DeGarmo, founder and director of the Foster Care Institute. Hey, Mandy. Glad you're here this tonight, Mandy. I see also that Daniel's here tonight, too. I see that Stephanie's here, too. Glad you're here this tonight. We're answering your questions live. Answering your questions live right here. Brenda, as I said earlier, will get that newsletter to you. Look for it later on. If you want the Foster Care Institute, just type in I want the newsletter that went out earlier this morning to over 12,000 people. Foster Care News of the Week, Webinar of the Week, Foster Care 101 video tip, and so much more. Absolutely free. Type in I want newsletter, put your email address. We'll make sure that you get it, okay? Thomas says, are you able to see the question I posted earlier in the comments? Thomas, no, I'm not able to see that. So go ahead and put the question in, and we'll make sure that we're able to answer, because I'm not seeing it here. I'm sorry. Because right here we're looking at live, and I don't see it come up. So go ahead and ask that question again, Thomas, and we'll try to answer it right here tonight live. Hey, our brand new training webinar, Fetal Alcohol Spectrum Disorder, FASD, Part 1, came out 2 weeks ago. 2 weeks ago. I hope you watched it. I hope you're able to watch it. So many children in foster care are not properly diagnosed with some form of fetal alcohol spectrum disorder. Hey, I want to say hello to Asia. Asia, glad you're here tonight. Asia, welcome to Foster Talk with Dr. John. We're answering your questions. Any question you have, go ahead and answer that. So yeah, a lot of children in foster care are not properly diagnosed with fetal alcohol. You hear about fetal alcohol disorder, right? Well, that falls under fetal alcohol spectrum disorder. There's a number of fetal alcohol disorders, okay? So hopefully you've watched that webinar. Part 2 is coming out next, I'm sorry, 1st of August, all right? So if you don't have access to that webinar, we have over 65 hours of online training webinars. Let me ask you this question. Let me ask you this. Do you need more training webinars? Do you need more training hours? Do you need more CEUs and licensing hours? Get it right here. Join me at the Foster Care Institute. Get all the training webinars you need, over 65 hours, printable certificates, 15 free ebooks at less than 70 cents per webinar. Can you imagine that when you join? So I want to make sure you get membership. If you need help joining, let me know and I'll point you to the direction. Brenda, hey, Brenda, welcome to Foster Talk with Dr. John. So when a birth parent asks us to help watch a child after they return home, should we send an email to the caseworker with a small comment about how often we are stepping in to help bio after return home? Yeah, Brenda, that might be a good idea. That might be a very good idea. More importantly, Brenda, you need to be documenting it, okay? Properly documenting it. I said earlier tonight, Brenda, there's a right way to document And there's a wrong way to document. And if you do it the wrong way, Brenda, you could place yourself in danger as a foster parent. There's a lot of do's and don'ts when it comes to properly document. You may be asking yourself, what do I document? When do I document? Why do I document? How do I document? How do I do it? Brenda, there's a great book here at the Foster Care Institute that you can download. I think it's only $12. Has all the files, forms, ledgers, information, documentation forms, a whole explanation about how to document everything you need. You can keep printing these forms out over and over and over again. It's a must for every single foster parent. We created this one because we need, hey, I've had 2 false accusations as a foster parent. Very stressful time indeed. And false accusations, false allegations against foster parents are quite normal. How you address it is important. Otherwise, you could lose your license. That's why it's so important. So, Brenda, yes, I would let the caseworker know, not only in an email, okay, but I'd also properly document it and keep a record of documentation. When the child went to visit, or the day, the time, the date, the location, how long they were there, how the child was before how the child was afterwards. So much to it, okay? So I think, Brenda, you've got a great question. You absolutely should let the caseworker know and go into documentation. Appreciate being here, Brenda. Thank you for asking. Thomas, all right, Thomas says, so how do you let your agency know you need to disrupt? Our first placement was 4 years old, nonverbal and developmentally delayed. She's made progress with speech in the 6 weeks we've had her, but her behaviors have getting to the point we can't even use a bathroom without her doing dangerous things for attention. I understand. I've been there. She demands one-on-one attention. She's already been removed from one daycare because of attention seeking, and there are no other options where we live. We have referrals for a neuro consult, speech and behavior therapy, but we were told it'd be at least a month before they call a schedule. We are so attached to her, but when we decided to do this, cause us problems with our marriage, we would disrupt. Any advice is appreciated. Thomas, you need to ask to have the child removed. I know how hard that is, Thomas. I know how hard that is. If you read my book, Fostering Love, this book right here, if you've read this book, you know about a time I had actually had a young girl named Helena to be removed from a home. And I had so much guilt for years for doing that. I thought I let her down. But I also recognized, Thomas, that I had to do it to keep my own family safe. She was doing some things in our family that was dangerous to the children in my home as well as to our marriage. Kind of sounds like what's happening in your home, Thomas. So you just need to say to the caseworker, here's the documentation. This is what's happened. We are unable to provide the support this child needs. We're unable to provide the resources this child currently needs. We're unable to provide the stability and structure this child needs. As a result, we're going to ask this child be placed into a different home where she can get the proper help that she needs, because at this time, we can't give this child what she needs. I think the caseworker is going to understand it if you come at it from that direction. Okay. Listen, Thomas, if you want to have a special one-on-one foster parent counseling session with me, I'd be happy to schedule a session with me. Not a worry. But Thomas, again, I know how hard it is to ask to have a child removed from your home. I had so much guilt when I did it. Boy, that's a long story, let me tell you. But it sounds like it's the best thing for your family and the best thing for your marriage. And sometimes we have to recognize that we have to say no. We have to say no. It's a hard thing for foster parents to do. I completely understand. But for the stability and mental health and the well-being of all involved, including the child, it sounds like there's a better home, a better fit for her someplace else. That's nothing against you. Nothing against you. So I know how hard it is. Appreciate you asking, Thomas. Appreciate you being here. And thank you for what you're doing for that child. All right, this is Foster Talk with Dr. John. We got a couple more minutes left here, just a few more minutes left. We want to make sure that we get your questions answered right here live. We're answering your questions. So again, no questions off limits. If you're struggling with something, if you need help with something, we want to make sure that you get the special help, the special support services that you need as a foster parent, as you care for children in crisis in your own home. Hey, foster parenting is hard. I'm the first to admit it. As founder and director of the Foster Care Institute, I'm here to tell you it is tough. There have been times where I felt like quitting. There have been times where I've questioned the system. There have been times where I thought, I just can't do this anymore. At the same time, every child that's come through my home has made me a better person in some way. Every child has, every child. It's been the most rewarding thing I've ever done as a foster parent. Thomas says, it was hard, but we had a meeting with our worker today and voiced her concerns. Thankfully, she understood our concerns to find her a new home. Our agency found her home within an hour with a special education teacher that doesn't have any children. We've been communicating with a new family, and it's going to be a gradual transition over the next week. Thomas, that is fantastic. Good for you. That's good. That's perfect. It can't really get much better than that. I would encourage you, Thomas, to continue to stay in that child's life for her own issues of trust and attachment. So she recognizes that somebody just did not desert her, that she was not deserted by you. At the same time, that new foster parent might need a bit of respite at some point in the weeks, months, years to come. Hopefully, this child will not be in foster care very long. Hopefully, there'll be a reunification or adoption or something like that for her. Right? We don't want any child to linger in foster care any longer than necessary. But I would encourage you again, stay in the child's life, be a support service for her, be a relationship for her. Right? So she knows that you did not desert her. People are not going to desert her. That she can still trust other people because she can still trust you. And again, that special ed teacher might need a little bit of help. Again, Thomas, if you want to have a special um, foster parent counseling session with me, I'd be happy to do that to help you out. Just let me know. All right, just let me know. Hey, this is Foster Talk with Dr. John. We may have one more minute. Let's see if we can squeeze in one more question here from you before we go. We're answering your questions here live right here. We do it every single Tuesday night, 7 to 7:30 p.m. That's not true. That's the old time. I'm sorry, 8 to 8:30 p.m. right here live. Guess what? It's 8:30 already. Time has flown by. So glad you could be with us tonight. Thank you for spending your Tuesday night with me. Thank you for all that you do for kids in foster care. Thank you for making a difference with these children. Aisha, so glad you joined us tonight. Listen, if you don't get the foster care newsletter, type in I want newsletter, put your email address. I want newsletter, put your email address. We will make sure that you get the foster care student newsletter first thing tomorrow morning, if not tonight. And don't forget, sign up for that webinar program. I hope you're already a member, so you have unlimited access to all the training hours that you need to stay licensed and to have the support services that you need as you care for children in crisis. All right, my friend, we're going to be right here, back here. I'm out to Pennsylvania Thursday. Today's Tuesday. I'm out to Pennsylvania this coming Thursday. Hey, if you attended our virtual conference, the Advanced Foster Care Virtual Conference last week, so many great presenters. I want to say thank you for being part of that. I was in Texas last week, and I want to say thank you to Lone Star Services for allowing me to be part of their program. Again, off to Pennsylvania coming up, and then going back to Florida in a couple weeks for a big foster care event. Can't wait to tell you about it. It involves a foster care movie that I'm going to be speaking at the world premiere of the film. I'll tell you more about that coming up. For the Foster Care Institute, I'm Dr. John DeGarmo. Thank you so much for joining us. We will see you. Hey, Giggle. So glad you're here tonight. We'll see you next Tuesday night. Bye-bye.